a lot of things that prevents, I still want to talk about things that prevents getting pregnant. So one is anxiety. That is a lot of that in our lifestyle these days. That is the cause of infertility. That's a huge thing, but people don't pay attention. And then at work, etc. So actually, I do know women, they actually stop menstruation if they are stressed, if they change jobs, move houses, even it can stop their menstruation. So stress is a huge thing. So because people are looking for causes, right? So why am I not pregnant? Another thing, as I said, overuse of hormone, that can be another thing. But there are times that we actually encourage people to do physical checkups first, just in case there's any blockage, like fallopian tubes that was blocked, or one side of the ovary that is not releasing eggs, etc. There are actually a huge number of things that can just block your fertility. Is just not one reason. Another thing is, of course, it's not just women's problem. It's actually both party, right? So if everything is okay with the lady, and then we do encourage the husband or the partner actually to do their part. So nowadays, I think the quality of the sperm, and also the quality and quantity of the sperm sometimes can be quite worrisome, and so that can be another reason for infertility at this time, at this age.
That's a great point. We know that 50% of all infertility cases are caused by men.
Oh, 50%. That's very high.
Zero. And I think with men, it's the testing is so simple, right? It's not invasive. And we can learn so much so quickly. And I would always just start with that to rule it out. There's some great at-home tests that men can do right away to learn, are they the problem? It's not always the woman.
Yeah. Okay, so at least nowadays, I think a lot of the guys, they actually accept the idea that okay, we should both go for treatment. Also, sometimes it's the sperm problem, the quality and quantity can be actually boosted up by using Chinese herbs and mansa. Actually, they didn't know that actually give you very good results. That without drugs, without surgery, without too much worrisome. And that actually helped, because nowadays a lot of people, their lifestyle is a problem, and then they overwork maybe, or they over playing games at nights without too much sleep, and that can actually cause a lot of health problems that is maybe not visible from outside, but you're deteriorating pretty fast inside. And so people don't know. So with actually this, whole process of fertility treatment, actually people regain their health. I think if they don't get a baby at the end, but still this will help, help them to regain their health. And I think I see patients appreciate that actually. So, but anyway, yeah. Do you have other questions for me? Let me see if I have any questions for you. That's about what I have for
now. Any interesting cases in your clinic recently?
Oh, recently, it has been, I actually moved out of the country and came back. So I don't see fertility patient too much nowadays. But all the data I have is maybe throughout my practice until the last few years. But anyway, so recently I will say not really. I think another thing that people want to be careful is some disease can cause miscarriage, and some drugs can cause miscarriage. I try not to be too specific, but that does happen. And if it distort, most of people's menstruation, then it can affect pregnancy. It can cause miscarriage. Oh, another thing, actually, there is one case I would like to talk to you, but that is not recent, but still it's because I saw, a lot of videos nowadays still, a lot of women, they are supposed to be very strong, but during their, pregnancy, I can see from their tummy probably third semester, trimester, semester already. And then they're still doing a lot of weightlifting, running, etc. That is totally not encouraged. And I have seen patients, they lost their baby, lost their pregnancy by walking or running on the treadmill. That, I mean, there is really no reason when you are pregnant that you want to do that. So try your best to be calm and to protect your baby and yourself. That's a message I have for those ladies. You can say, okay, I do this all the time. The one lady I knew, she was a tennis player, but she's already like 46 years old. After all that treatment, she got pregnant and she was very happy. But then after she walked on the treadmill, I don't think she really run, just like jogging, fast walking. And then she lost her baby. And that was a very, very sad time for her. And so I will highly encourage people not to do that. So that is a message.
As we spoke about earlier, there's almost always a deficiency component with infertility and miscarriage.
Right.
And so if you are using energy for strenuous exercise, then that will drain some of your energy. You'll feel good temporarily because your body is running on adrenaline, but the key way to measure fatigue or energy levels is to go 2 days without caffeine or exercise and see how you feel.
All right. Okay. Well, that is something we can actually help people and also tell them to prevent doing this, to protect their baby, their pregnancy. Anyway, okay, I think that's it for me for today. I mean, in the future, there's so much that we can talk about, in gynecology, even menopause, fertility. We can always do an update meeting or discussion in the future. And I think that will help us to understand, fertility, and also help people, down the road, how to get pregnant. That is a big thing, nowadays.
Absolutely. Absolutely. Thank you, May.
Okay. Thank you, Daniel. Talk to you soon.
Talk to you soon. Bye-bye.